Lokachi paired beneath the stain, oxidase positive. Meningococcus is the name. And glucose and maltose both can feed its energy. Unlike gonococcus, maltose is the key. Chocolate agar helps the colonies survive. Thayer martin keeps selective growth alive. Vancomycin polymix and nystatin in the mix. Trimethoprim completes the VPN for drug fix. Pili grip the mucosa, then change what antibodies see. Antigenic variation helps it flee immunity. The protease clears the fences from the way. OPA proteins bind host cells so the bacteria stay. Meningitis, droplets in the air. Dorms in military quarters, close contact beware. Capsule blocks phagocytosis, Luz ignites the fight. Fever, stiff neck, petechial, treat it fast and right. Ceftriaxone or penicillin, never hesitate. C5 through C9 deficiency raises Neisseria's rate. It colonizes nasopharynx, sometimes without a sign. Asymptomatic carriage may continue for a time. Then it enters blood vessels, spreading hematogenously, turning colonization into invasive disease. Its polysaccharide capsule keeps the phagocytes away. Though the capsule from serogroup B is weak in what it can display, it poorly stimulates immunity, resembles human cells. So protein-based vaccination targets B instead as well. Lotions in the outer membrane drives inflammation high. Blebs release enormous loads as bacterial cells multiply. Endothelium is injured, capillaries start to leak. Fluid leaves the circulation, blood pressure growing weak. Hypovolemia and septic shock can rapidly appear. Hemorrhagic necrosis makes the danger severe. Vasoconstriction and injury bring thrombosis to the scene. Platelets fall as coagulation burns through the machine. Disc can start unfolding as the clotting pathways begin. Protein C dysfunction helps the coagulopathy begin. petechial become purpura as the illness gains its speed. Meningococcemia is truly an emergency. Meningitis, droplets in the air. Dorms in military quarters, close contact beware. Capsule blocks phagocytosis, Luz ignites the fight. Fever, stiff neck, petechial, treat it fast and right. Ceftriaxone or penicillin, never hesitate. C5 through C9 deficiency raises Neisseria's rate. Waterhouse-Friderichsen, adrenal glands can bleed. Acute adrenal failure follows meningococcal disease. Hyperglycemia, hyponatremia enter in the frame. Hyperkalemia rises as the cortex fails its aim. A febrile flu-like prodrome may be first to show. Malaise and intense myalgias before the crisis grows. Headache, nausea, anorexia, upper airway signs. Sometimes meningitis that resembles strep's design. Then bacterial meningitis brings the classic tried it near. Fever, headache, neck rigidity make the diagnosis clear. It is the second most common acute bacterial cause, so do not let a quiet early presentation give you pause. Lumbar puncture shows the bacterial pattern in the fluid. Protein elevated, glucose low, parasites recruited. Organisms may be visible when CSF is reviewed, but stabilize and treat at once when meningitis is pursued. Later immune complexes may leave another trace. Arthritis or pericarditis after infection takes place. The membrane attack complexes the host defensive line. Terminal complement forms it. Components 5 through 9. Without those factors, recurrent Neisseria may appear. So terminal hypercomplementemia should bring suspicion near. Asplenia also raises risk from encapsulated disease. Vaccinate the vulnerable before exposure, please. Ceftriaxone is effective when invasive disease is found. Penicillin works when susceptibility is sound. For severe beta-lactam allergy, chloramphenicol may stand, but rapid empiric treatment is the life-preserving plan. Close contacts need prophylaxis after major exposure time. More than 8 hours and 7 days can meet the warning line. Right vamp and site prophylaxis in the ceftriaxone can clear nasopharyngeal carriage and protect the people near. Quadrivalent polysaccharide vaccines cover 4 groups. Capsular antigen defends the vulnerable troopers. Conjugate vaccines link the capsule to a carrier protein. And if there fast and bright.